How does the Stroop test relate to schizophrenia? Have you ever tried to say the color of a word while ignoring what the word actually says? That's the Stroop test, a fascinating psychological task. It measures how well we can focus our attention and control our thoughts. In this test, participants are asked to name the color of the ink used for color words. Sometimes, the word meaning matches the ink color, and sometimes it does not. This creates a challenge, as our brains often want to read the word instead of naming the color. Now, let's connect this to schizophrenia. Individuals with schizophrenia often experience attention deficits and difficulties filtering out irrelevant information. This is where the Stroop test becomes particularly relevant. Research shows that people with schizophrenia tend to struggle more with this task. They find it harder to ignore the distracting word meaning when it conflicts with the ink color. This increased interference reflects the everyday distractibility that many individuals with schizophrenia face. The challenges seen in the Stroop test may be linked to issues in the frontal regions of the brain. These areas are responsible for executive functions, including attention control. When someone with schizophrenia takes the Stroop test, the results can indicate an overload of consciousness. This means they might be overwhelmed by unimportant information, which can make it tough to focus. Interestingly, not every person with schizophrenia shows the same level of difficulty on the Stroop test. Factors such as individual symptom profiles and different versions of the test can influence performance. Some studies have found that the severity of thought disorder symptoms correlates with how well someone performs on the Stroop test, especially in those with paranoid symptoms. There are also emotional versions of the Stroop test that include emotional words as distractors. These tests help researchers understand how cognitive and emotional control are affected in schizophrenia. Patients often show slower response times and greater difficulty suppressing irrelevant emotional information. This highlights the complex relationship between cognitive and emotional processing in the disorder. When it comes to treatment, medications like neuroleptics do not seem to significantly change Stroop test performance. This suggests that the attention deficits seen in schizophrenia are a core part of the illness itself, rather than a side effect of treatment. In practical terms, the Stroop test is a useful tool for clinicians and researchers. It helps them understand the nature of attention deficits in schizophrenia. This understanding can inform cognitive remediation strategies aimed at improving patients' ability to focus and filter distractions in their daily lives. Overall, the Stroop test offers a measurable way to assess selective attention and cognitive control in individuals with schizophrenia. It reflects the challenges they face in managing competing cognitive demands and suppressing irrelevant information.